this is a really important thing to look at, because this comes from directives from our public health organizations and agencies. Lots of people who don't have any symptoms and didn't get ill test positive for this, as well as many people who are ill and have symptoms test negative. So since we don't really know what we're testing, in my opinion, we can't trust the results of this test at all. If someone dies and you suspect it may be COVID-19 related, that not even to bother doing a test post-mortem, just label them on the death certificate as COVID-19.
And the media never says someone died of COVID-19. They died after testing positive to COVID-19. And doctor, now it's become a meme where even the public seems to be catching on, where somebody, some wife shot her husband in her home because they were locked down because of COVID-19, so he died of COVID-19. I mean, it's almost not funny that it's become a joke, because the public seems to know that now everything is being overclassified as COVID-19 related.
If they sent them for autopsy, they would probably find that they died of a regular cause. And this would affect the numbers in a bad way in terms of if you're trying to create the appearance that a lot of people are dying from COVID-19. So what I've done since you can't trust this data about the cause of death because of these instructions, and they've essentially gone away from their usual protocols where you want to have some certainty about the cause of death. And they've said that even if there's suspicion that COVID might be the cause of death, that you should just put that as the cause of death on the death certificate.
You just put that as the cause of death on the death certificate.
Without any further scrutiny. Whereas someone's child, I think they were a young adult, died in a motor vehicle accident. And on the death certificate, it said they died of COVID-19, and they were really upset because they had no legal recourse related to the traffic accident to, file with the police or get reimbursed by the insurance company, because the death was recorded as being from COVID-19. And so they took this sample of lung fluid, which has genetic material from many sources, and they added an enzyme that would digest any cell membrane. So it basically allows the DNA or RNA to be free in the solution so that they could do further analysis. And then they've identified a sequence of RNA that they allege is from a coronavirus or from the coronavirus family. But the thing is that since this sample is impure and has many sources of RNA, it's impossible to know what the origin of it is. This is extremely weak science, and without purifying the lung fluid sample, you really can't tell what the origin of the RNA is. So they've used this sequence to develop the main diagnostic test that they're using, which is the PCR test. And aside from any problems using the PCR methodology, we simply don't know what it's testing for, because we don't know the source of that genetic material. In fact, they call this virus the SARS-CoV-2, is that they looked at the identical nature of the sequences, and they found that it was just under 80% identical. And that's how they said, well, it must be related, and so we'll call it SARS-CoV-2. But the thing is, if you look at the genetic sequence between humans and chimpanzees, you'll find that there's 96% sequence homology or identicality. And so we are clearly not the same as chimpanzees, and no one would say that our genetic material is part of the chimpanzee family. But yet they're using a sequence identity that has a much lower percentage, under 80% compared to 96, and saying that's a coronavirus because of that. Where there are scientists claiming to find evidence for a new virus, that they claim to isolate the virus. And I've basically scrutinized their procedures, and I've compared that to the history of how viruses and other diseases are proven to cause disease and how they're identified. So I've become familiar with the procedures and how they work. And what I've found is that the scientific procedures that have been utilized in all of these scientific studies are actually, it wouldn't be possible using those techniques to isolate a virus and purify it and prove that it exists. But in looking at what I do know about the CDC, One thing is that it is mostly funded actually by private industry. So there's something called the CDC Foundation, and you see that all of the major companies that represent the healthcare industry, such as pharmaceutical companies, health insurance companies, medical device companies, etc., are the financiers of the CDC. And they certainly have a lot of profit to gain based on having a serious pandemic and needing to sell vaccines or testing kits and things like that. I think the hospitals are in a different position financially right now. But it seems that all of the policies that they've initiated would have to be for the immediate purpose of inflating the perception of the health consequences of this COVID-19 situation.